Now, with just 10 days to go, would you believe, until the general election, we've been meeting key women from the major political parties. Last week, as you know, I talked to Labour's Angela Rayner and the SNP's Mary McCallan. Today, Health Secretary and Conservative candidate Victoria Atkins joins me now. Victoria, great to see you. Now, you had, and this is more, you know, we're trying to sort of get to the bottom of what it's like to be a woman in politics now. You had a job before you came into politics. Do you think that made you better at what you do? Does it make you a better MP?
I think having a bit of life experience, and that can take many forms, but having a bit of life experience definitely helps in politics because it's a tough profession, and you have to have a bit of resilience to put up with all the knocks and the scrapes. But it's also an incredible profession as well. We get to do some amazing things. We can make a really positive change to people's lives.
Well, see, that's interesting to hear that, because we usually do focus on the negative, especially when women are concerned. We ask women questions that we wouldn't ask of men, for example, about childcare. You know, you had a situation where you were working, you were doing some interviews, you were working away that day, you had to bring your son with you. Now, we don't ask men about that.
No,
we don't we not?
No.
We never do that.
Not at all. And the impact that it has on our family and our, you know, loved ones and our friends, I think sometimes when we're and this is across the board, when we're being attacked, people don't always think about how it affects our loved ones. But no, I mean, my 12-year-old, because when we do the morning media round, it starts very, very early, and my husband was away, and so I couldn't get childcare for like 6:30 in the morning. So he was on holiday, my 12-year-old was on holiday, so he came with me on the media round. He loved it because all the cameramen were lovely and sort of took pictures of him and so, but yeah.
Because you sometimes forget, you know, MPs are human beings.
Yeah.
This is the thing. You grew up, though, your family was very much steeped in politics. You know, your dad was an MP. Did that make it easier for you that you had some kind of knowledge of this world?
Yeah, I mean, look, I grew up in the political world, but I did not want to go into politics.
Did you not?
No. So I started a career working in the criminal courts, and I ended up prosecuting criminals in the sorts of cases that you'd read about in the newspapers. But I got to a stage where I could see so much harm was being done before cases even came to court, and I wanted to try and help stop that. So fast forward a few years, and I found myself not only as a Member of Parliament but also as a Home Office and then a Justice Minister, and I was able to help particularly young people with early intervention schemes that we were setting up to try and steer children and young people away from crime. And that's the sort of positive impact that politics can have.
It can, and a lot of people, are you worried? Because I spoke to Angela Rayner about this last week, about voter apathy. And I also asked her if the election was in the bag, because the polls are, as you know that, you see them, and Labour are so far ahead. Do you think then that people just won't bother voting, or do you think it's all over? That's it?
So I really hope people don't, decide not to vote, because when you think of the history of our democracy, when we look around the world and we look at places such as Ukraine that are under attack, we are so lucky and fortunate to live in a free democracy where we have the liberties to vote as we wish, to demonstrate, but also to make real changes in our society that I hope women and mums at home will be appreciating. So, for example, as female Health Secretary, I've prioritised women's health because I think the NHS was designed 75 years ago by men for men, and there's a lot we can and should be doing with women's health that I'm determined to do as Health Secretary. And so things like that, we can't, those are really important issues at stake in this election. And whatever the polls say, actually, there's only one poll that matters, and that's on the 4th of July.
That's very true. Obviously, as you said, Health Secretary, we know this morning there's been a declaration of a national emergency. Now, the NHS is such an amazing thing for us to have, but it looks broken. How on earth do we fix that? Where do you start? How can it be tackled? Because it seems to me like it's people are just kind of going, throwing more money at it isn't going to work. What do we think? Do we just start again?
No, so look, the NHS is genuinely one of the reasons I came into politics, because I was diagnosed with type 1 diabetes at the age of 3, and so I've seen the very best of the NHS. But I've also seen some of its darker corners, particularly when I had my baby. And so I think we've got to be realistic about what the service can provide. By the way, the NHS looks after 1.6 million people a day.
It's extraordinary.
And most people actually will have a good experience. We are treating now, we have 4 million more people coming through A&E today, or this year, than we did in 2010 when we took over. So the scale of it is enormous. And part of our plans that we've had over the last year is about finding new ways of working. So we've introduced Pharmacy First to help people with the most basic conditions go to their pharmacist rather than needing to contact their GP. We've introduced virtual wards. So with some health conditions, people can be monitored at home rather than having to come into hospital. It's better for them, it's better for hospitals. We're training far more doctors and nurses, midwives and dentists than we ever have.
Well, that's what we need.
Absolutely.
We absolutely need that, because that's the problem, isn't it?
In the system now. So it is, we all understand the challenges, but I genuinely think that after the pandemic, it's been very difficult. But we are already beginning to see some real changes in things like A&E waiting times.
Your party are the only party that have had, 3 female whatever you may think of some of them, but prime ministers. Your tips is a future one. How do you feel about that? Because it's been, I know you can go, but it has been. You are someone that people think could be in the future. Is that something you would want, that big job?
Well, I'm really proud of the fact that our party has had, as you say, the first 3 female prime ministers, and the impact. I know, with both Theresa and Liz, when they were prime ministers, it means that young girls and young women look at their prime minister and think, yeah, I can do that. That's not.
A lot of them would think I could do that a lot better. That's the thing.
But that's democracy, and I'm really proud of the fact that we have that. I would encourage any woman to get involved in politics. Our voice needs to be heard around the table. And so when, for example, I'm sitting down with the Prime Minister and I'm saying, I want to prioritise women's health, I want to prioritise maternity services, that's because I understand how important these services are for women. And also ensuring that women are not eradicated from our National Health Service or our public institutions, that we're not frightened of using words like mums and breastfeeding, and we're talking about individuals as humans rather than using phrases that none of us really, I think, feel any sympathy for or really understand why they're being used.
Victoria, thank you for coming in. It's a slightly different kind of interview that I'm sure you will be getting, because we are concentrating more on women in politics. And tomorrow we're going to be joined by the Lib Dems Deputy Leader, Daisy Cooper. Thank you very much. Good to see you.